There is so much beauty in our differences. No two people are alike, and each of us has characteristics that make us uniquely and distinctly us. But there's mystery in those differences too, especially when it comes to medicine. In the past, diagnostics allowed us to generally understand a disease, but analyzing, understanding, and treating its unique properties were out of reach. Until now. The future of healthcare is here. Diagnostics are an important part of every stage of medical care. In fact, 70% of medical decision-making is influenced by diagnostics, and that makes molecular diagnostics one of the most important advances in the last century. Simply put, molecular diagnostics are tests that detect specific genetic sequences and proteins to help make individualized and therefore more effective medical decisions for patients. The Society for Women's Health Research works to understand diseases and conditions that affect women more than or differently from men. We know that in every instance, from cardiovascular disease to cancers, molecular diagnostics provide the critical insights we need. For example, consider coronary artery disease. As a common precursor to heart disease, coronary artery disease is currently the leading cause of death for women. The symptoms are different in men and women, making it difficult to diagnose. Traditional methods of diagnosing CAD are costly and invasive, and far less effective in identifying the disease in females. But that reality is changing, due in part to a test that takes into account key biological differences between men and women. By measuring the activity of specific genes in the blood that are altered by narrowing or blockage of heart arteries, this test uses unique properties to provide a more accurate diagnosis, particularly for women. Better yet, the test is non-invasive, requires no radiation exposure, and can be completed in as little as 72 hours. The future is here. These advances revolutionize how we approach diagnosis and treatment of hundreds of diseases, including lung cancer, HIV/AIDS, cystic fibrosis, childhood cancers, and Alzheimer's. The Society for Women's Health Research believes in the promise of molecular diagnostics, which is improving the quality of life for millions of people. It's an exciting evolution in healthcare that is already transforming health in ways never before possible. To learn more about molecular diagnostics and the biological differences between women and men, visit swhr.org.